President Cyril Ramaphosa has indicated that he will soon sign the National Health Insurance, the NHI Bill, into law. The NHI aims to introduce universal health care, with the state acting as the single buyer of medical products for the population, eliminating all private health care outside of voluntary treatments. Let's weigh in on this further. Professor Alex van den Heever, Wits governance expert, joins us to discuss further. Prof. Alex, good afternoon, and thank you for your time on the SABC at this hour.
Good afternoon.
The National Health Insurance is a step closer to being signed into law. We understand that the bill has caused a whole lot of tension between the state, healthcare industry, big business at large. And so perhaps you could talk to us about the impact that NHI will have if it is signed into law while the president looks for his pen.
Well, I think that that signing the bill into force, turning it into an act, is not actually going to make a great deal of material difference to what happens on the ground. What will happen is there will be incredible uncertainty generated within the health system, because the proposals themselves are not likely to expand or extend universal coverage, but are more likely to undermine it. That's really the general perception of a large part of people who understand the health system in South Africa. So there are a lot of concerns about what the purpose is of this legislation, and whether or not that purpose is actually in the public interest. So I think the first consequence is going to be uncertainty, and a lot of people are going to anticipate something being done, but being very unclear about whether or not the government is actually capable of doing anything but harm. And under those circumstances, that perception in itself is extremely damaging.
And so, Prof, at this point, given the timing of it, and you questioning the purpose at this point, should South Africans be worried about it, given that there are so many more questions and answers at this point?
Yeah, so there are enormous concerns, because what this proposes to do is to consolidate procurement in the hands of very few people, all politically appointed. And corruption, and the source of corruption in South Africa and state capture, has been exactly to target such institutions, such organizations. So when you concentrate the power in the hands of very few people, the possibility of corruption goes through the roof. And given that the actual accountability structure design for the NHI is equivalent to virtually all of the state institutions that have collapsed in South Africa, there is the possibility that there will be absolutely no accountability for any malfeasance that occurs through this. But this is their intention. But what it will also do is massively disrupt the provincial systems of delivery, financing and delivery, as well as create massive uncertainty in the private sector. So effectively, rather than creating or expanding universal health coverage, we're more likely to see a collapse of the coverage we already have. This kind of reform and the way it's been structured, designed and rammed through is not designed really to actually improve healthcare. It's got another purpose behind it, and that purpose is not to actually expand health coverage. It is very likely, given the way that the accountability structure has been designed, very likely that it is becoming a great big piggy bank for some people to put their fingers in.
And so those are some of the concerns that have come to the fore. And just given the skills crisis in the country as well, some are questioning that whether this is also going to be addressed through NHI then. The sustained efforts from the Department of Health to address South Africa's healthcare worker crisis. I mean, what is it looking like from your vantage point with regards to NHI then?
So firstly, the resolving South Africa's workforce crisis would require that government is actually able to design and implement a strategy for workforce. You don't need an NHI for that. We've already got a system that allows them to do that. The problem is that government, and this now includes the National Department of Health as well as general government, the people who basically allowed massive salary increases at the level of the central bargaining chamber and passed those costs on to provinces, shows that government doesn't actually know how to manage the finances and the deployment of resources within the current health system. So what's happening is that they've pushed up the numbers of people who are coming through universities, but have downsized the number of posts that could absorb them. And this mismatch is because there's absolutely no strategic planning that is linked to financing in government. And this is really quite straightforward stuff, but just shows nobody's terribly interested in joining up government. So I think that if you can't do this right, it's very hard to see how you actually want to do something right with something considerably more complex that you've never done before. And yet you can't actually do the things that you're meant to be doing and do them efficiently. So our human resource problems that we've got in the health sector need to be resolved, and an alignment needs to be created there. But what we've done this year is that we've allowed for budget cuts effectively to happen part of the way through the year, massively impacting on provincial administrations and their ability to actually manage going forward. So even a very competent health administration like the Western Cape Department of Health is struggling under these circumstances. But the other provinces are in an even worse situation.
And Prof, even going for the single purchaser model, and just looking at the basket that will be on offer for South Accans, what it will consist of, etc. I mean, what concerns arise on that front, just in relation to what you've spoken about, issues of procurement, accountability at large as well?
Well, government it's so far away from having the capability to actually design a so-called basket of services for which it will guarantee access. Technically it can be done right now. It doesn't need an NHI. But it hasn't been done for 30 years. Effectively, the basket of services you have access to are the services that exist. So if you go to a hospital and they don't have oncology services or the drugs aren't there, that's your package that you have available to you. So the designing of the package itself is a task that is going to exceed the capabilities of this government through a single purchaser. A single purchaser arrangement is way too complex for this government to consider, where it would try and match up a supposed package of entitlements with a reimbursement system. They're in no position to do this at all at the current stage of capability of national and provincial governments. So we should actually be starting with stuff that we can actually improve. But that is a leap too far. So central purchasing is not going to solve the problems of the South African health system. It's utter nonsense. So our budgeting systems are adequate to run decent health services. But if we don't put in place the proper governance structures to run our public services and the regulatory structures to ensure that our private sector is stable, if we don't do that, then the system starts to shake and heave and collapse. So the point is government's not attending to those things, but it's promising to do something that maybe will achieve results in 30, 40 years. So what you have in the bill is basically a blue sky proposal for which they have absolutely no idea how to implement. And it will take many, many years for them to realize they can't do it.
Some have likened it to a Ferrari without wheels. And so, Prof, also just in the issue of a trust deficit at this point, and given the mammoth tasks ahead in relation to the NHI, we're looking at the issue of accountability. And with the advisory committee, the NHI Ministerial Advisory Committee, some are questioning whether the deliberations will be made public, how the public is going to access this information. Also on that front, what concerns arise? And for users who aren't registered under NHI, will they be denied healthcare access? I mean, how do these also get factored in reality?
Yeah, I must say that I can't actually see a lot of that stuff coming together. But the problem of just establishing committees to decide on hugely complex tasks, which they've never done before, is in itself problematic. And when you design packages of services, which I said is an obligation that is required today, it's not something that requires an NHI, and government hasn't done it to date, is a technical process, but it is also a process of substantial social engagement. You don't just create benefits and say this is what you're entitled to. Society must have a say. So we need to do that anyway. It's got nothing to do with NHI, but it doesn't get done. The other problem from the trust deficit problem, if we just have to look at the digital vibes issue and look at who's been held to account and to what extent, and when you see that the complete failure to hold a national minister to account, How are we going to hold the national minister who's in charge of NHI appointments, can interfere in the procurement processes, no matter how much people say they can't interfere? They can interfere because they appoint everybody in the kitchen sink into these organizations, and they exert influence through political party structures. So there's no way that you can say, no, it's somebody else making the decision. When we look at how these decisions that were corrupt have been made and who has been held to account, you're actually seeing the dry run for how NHI will operate. So this is the real problem, but it's not just health services. Obviously, this is what has happened to many of our parastatals and to the municipalities and to provincial governments. This is nothing new. And the trust deficit exists because nobody believes that anybody seriously is going to try and run an organization like this with good intent with the current governance model.